Welcome, everybody. I am Christina Alphonse, Associate Professor of Internal Medicine at Shams University. I present Enhancing Junior Clinician Competency in Hepatic Patient Nutritional Management. I was assigned to be under advice of Dr. Amal Hashish, Professor of Pediatric Surgery, Tanta University. In this presentation, I will identify the problem, explain my procedure, and mention the learned points. I wonder that there is 11 million deaths every year attributed to malnutrition. Moreover, 80% of cirrhotic patients are malnourished, and this is associated with higher rates of morbidity and mortality. Despite this, the appropriate management of malnutrition in cirrhotic patients improves the outcome. Yet, this is still under-recognized and under-treated. Medically trained clinicians are optimally placed to significantly improve mortality and morbidity globally, and this can happen through proper nutritional management. Yet, unfortunately, medical education remains insufficient to support clinicians to provide this adequate nutritional care. From this, there is an urgent need to establish medical nutrition education in curricula of medical schools. This pilot study aims at assessing the applicability and outcomes of increasing competency of junior hepatologists at Ain Shams University to be able to provide proper nutrition management for hepatic patients. This comes from our belief that this will significantly improve patient outcome and doctor's performance. First of all, we try to probe the insight of the junior staff about their knowledge. Are they keen to know more about nutrition? Are they oriented with the importance of nutrition in everyday management? So a questionnaire probing recognition of competency level was held, and all the junior hepatologists who show interest in the department were enrolled in a WhatsApp group for easier communication. An interactive session addressing how to do nutritional assessment was held, and a related assignment in the form of problem solving, followed by a personalized constructive feedback, was done after the session. Actually, this session was held on two separate occasions due to the tight schedule of the participants. Yet this was important to be interactive to help in calculations and avoid misunderstanding in any point. 5 coming sessions addressing nutritional requirement, problems, management, special conditions, and how to convince the patient to follow your instructions will be carried during the coming 3 to 4 months. Finally, at the end of the project and the duration, we will have a test to assess the acquired knowledge and follow up the trainees with observational follow-up in the outpatient clinic to assess clinicians' competency in clinical practice, health promotion, communication skills in his daily routine practice. Lessons learned was that medical nutrition knowledge is still defective among enrolled clinicians, yet they have the insight of this and they are willing to actively improve this. We had some challenges in the form of lack of knowledge, even the senior staff still lacking knowledge. So I started to study medical nutrition at the National Nutrition Institute, and also I'm trying to collaborate with specialized experienced doctors for guidance. Also, time was very tight. Yet, we were able to overcome this using online meetings with records, but not record only was not sufficient, so we have to repeat some sessions. Also, allowing a week for assignment submission that time. Thank you.